Can we talk about keloids?
I found this such, I know, this is such a struggle, even if you try to as best as you can to explain, what we're trying to do, the expectation.
I don't
Some
think
of this is,
in what you need to start out with is saying, we don't even know that we can treat your keloid. We can, if it's on the earlobe, we can excise it, and 95% of the time we have the chance that it doesn't come back. Laser is not the answer for everybody. Not everybody's keloids will respond to laser. Whether you use cryogen from the outside, and you do this monthly or every 6 weeks, and you do this for 2 or 3 years, or for 4 months, we don't really know who responds how. It's also extremely painful to treat any of those. And all of you are always at this quest when we see these patients with these multiple keloids everywhere, what can we do that the patient can even tolerate, right? And sometimes I ask you to do 3 test spots, one with the PDL, one with the 1540, and one with the Nd:YAG, to see, on a small area, to see what the patient can actually tolerate, and to see if their keloids might be worsening in response to any of those laser treatments that we do. And the providers, they sometimes do injections and sometimes external cryotherapy. But my first thing is, when I ever see somebody with a keloid, I'm going to have to say, I have no cure for this. And I don't even know if we can make your keloids better. And I don't even know if you can tolerate going through the treatment. But this is what we can try. So here's my long story and introduction to keloid. Yes, Bao, what is your question?
I guess, well, I try not to that extent, not as best as you're doing it, but I do try to tell them that it's very tricky and we can never cure it. It will always be there, and it has a mind of basically its own that it can flare up anytime. And then all the procedure will, responds the same. But I guess realistically, if we're trying, what is the best that I can do? Is it just to reduce the redness? That most of the time that it will?
There are some keloids that will actually respond and stop to be there. There are some. These are oftentimes the one that, you do something to them, somehow you are able to inhibit whatever that magical receptor is, that, maybe one of their TGF-beta receptors needs to be turned off in order to make the keloid go away. But, I think realistic expectations might include a time frame that you mentioned. However, there are some, that clearly lose their keloid. And again, we don't really have a way of predicting that yet. And we're trying as much as possible with the pulse dye laser. We turn off certain pro-inflammatory receptors so that the cells that are responsible for their keloidal material don't produce this endlessly. And so even with the pulse dye laser, we have excellent data to know how, in theory, how in vitro on the bench, how it works to inhibit the cells. But not everybody's keloid responds to the pulse dye laser. And we're not treating a color in the keloid. We're really treating a molecular mechanism on the inside of that keloid with any of our energy-based devices. We're not physically reducing the size with the 1540 only. We're also turning on or off certain inflammatory cascades, and this is how it shrinks. It's not the same as like a hypertrophic scar that just, takes a little time and then it will go away. Keloid is really a very, very different ballgame. And so if we feel that we're not really creating value by using a certain technology, we switch to another technology. In some of our patients, combination treatments work better, and in some others, they cannot tolerate the combination treatments. While we are willing to try a number of different treatments to get them to a better state, have the keloid be less painful and less itchy and hopefully shrink and hopefully disappear. Again, I am unsure that we can accomplish that in everybody.
You always say what's your wording? I use it, that Dr. Ringfile says that keloids and scars are always teaching us.
Yeah.